Welcome to today's Explainer. We are jumping right into something incredibly foundational today. We're going to break down a genuinely powerful manifesto on pharmaceutical quality and safety. For anyone in the life sciences, or honestly anyone who's ever relied on a medication, which is literally all of us, the concepts we are unpacking today are absolutely vital. We aren't just looking at standard operating procedures here. We are decoding a culture. It's a campaign known as the We Do commitment, and it's a framework that masterfully translates really complex manufacturing standards into a unified, human-centric mission. Let's get right to it.
Okay, let's dive into this. Section 1, more than a statement, the why behind the work.
In highly technical fields, it's so easy to get lost in the data, the machinery, and the regulatory audits. But this framework begins by intentionally pulling us right back to the human element of pharmaceutical manufacturing. It asks us to look at the ultimate purpose before we even think about the process. Take a look at this quote, "Quality today, better tomorrow, for patients." Now, in our source material, this text isn't just floating around on a blank page. It's deliberately placed right on the label of a medicine vial. And that serves as the ultimate why. It perfectly grounds the entire manifesto in patient well-being. Think about that progression for a second. It starts with the immediate action, quality today. That immediate action secures the future, a better tomorrow. And the ultimate beneficiary of both that action and that future is always the patient. This one simple phrase acts as the anchor for every complex procedure that happens on the manufacturing floor.
Now, what's really interesting here is how all these elements come together visually to tell a story. This is the complete overarching We Do manifesto. Notice the visual hierarchy. Your eyes are immediately drawn to those blue-gloved hands carefully cradling the vial. It's a super powerful image of protection, care, and precision, right? And above that, we see a dynamic, circular diagram detailing specific pillars, which we're absolutely going to get into in just a moment. But right now, just absorb that visual context. It beautifully balances the sterile, precise environment of pharmaceutical manufacturing with the deeply human responsibility of caregiving.
And anchoring the top left of that manifesto is this bold, overarching headline. It's not just a statement, it's our commitment. This is so important because, let's face it, we have all seen corporate posters that are just empty jargon, right? Words that look great in a boardroom but mean absolutely nothing out on the production floor. By explicitly calling this a commitment, the framework sets a completely different tone. A statement is something you read, but a commitment is something you live. This signals that we're looking at a living, breathing culture of quality, not just some box-ticking exercise.
Let's move on and see how this builds. Section 2, 4 pillars of quality, the how of patient protection.
So we've established the why, the patient, and the cultural mindset, the commitment. Now we need to look at the actionable steps. How does a massive pharmaceutical operation actually guarantee this level of quality every single day? Well, the manifesto breaks this down into 4 specific interconnected methodologies. Here we have those 4 core pillars exactly as they appear in the source's circular diagram: quality, compliance, teamwork, and improvement. What I really love about this is that they aren't presented as a simple vertical checklist. They're designed as a continuous cycle. They feed into one another. Teamwork drives improvement, which enhances quality, which ensures compliance, which relies right back on teamwork. It's like a closed loop of continuous excellence, meaning the job is never truly done. It's a constant, rotational pursuit of perfection.
So the crucial point is looking at the first pillar, we do quality. Because every step we take impacts patient safety. This completely unpacks the very definition of quality in this context. It's not some abstract metric. It is the direct link between everyday manufacturing steps and the ultimate safety of the human being at the very end of the supply chain. Whether it's calibrating a machine, logging a temperature, or inspecting a seal, this pillar reminds the manufacturer that there are no insignificant steps. Every micro-action has a macro impact on patient safety. Then we have the second pillar, compliance. Notice the really stark comparison here. On the left, not because we have to. On the right, but because it's the right thing to do. This is a profound shift in perspective. In highly regulated industries, compliance is often viewed as a burden, right? A set of rules enforced by external agencies like the FDA or EMA. But this manifesto flips that entirely. It audibly separates a mere regulatory obligation from a deep-seated moral duty. It essentially says, hey, we don't just follow the rules to avoid fines, we follow the rules because our integrity demands it. We do it when no one is watching. Moving to the third pillar, it reminds us that we do teamwork because great quality is never a solo effort.
The source material specifically highlights teamwork here to remind us that pharmaceutical quality requires absolute collective vigilance. You can have the best chemist in the entire world, but if the logistics team, the sanitation crew, and the packaging department aren't operating with the exact same commitment, the whole system fails. Quality in this environment is a shared ecosystem. It requires transparent communication and mutual support across every single department.
And that brings us to the fourth pillar: we do improvement. Every day, we learn, we adapt, we get better. Listen to the energy in those action verbs: learn, adapt, get better. This beautifully illustrates the dynamic and forward-looking nature of this final pillar. Science isn't static. Technology isn't static. Therefore, quality cannot be static. A true commitment to quality means acknowledging that what was good enough yesterday might not be good enough tomorrow. It requires a relentless daily hunger for optimization.
Which brings us to Section 3, building trust, protecting patients, the ultimate outcome. We've looked at the underlying purpose, and we've thoroughly examined the 4 actionable pillars. Now we prepare to synthesize those 4 pillars into their tangible results. Because what happens out there, in the broader world, when a manufacturer successfully lives and breathes this framework? We do is how we build trust. We do is how we protect patients. And this brilliantly illustrates the point. But I really want to slow down here for a second, because these 2 synthesized outcomes, extracted directly from the bottom half of our source document, represent the heavy weight of the pharmaceutical industry. Trust is arguably the most valuable currency in healthcare. When a patient takes a pill or receives an injection, they are exhibiting profound trust in a process they simply cannot see. By rigorously applying the 4 pillars, the manufacturer isn't just making a product. They are actively manufacturing trust. And through that trust, they are actively protecting patients.
At the very footer of the document, we see these 4 foundational commitments, complete with their own distinct icons: for patients, for quality, for trust, for a better world. Think of this as the unified summary of the entire manifesto. It takes all the operational rigor, all the compliance, all the teamwork, and distills it into a reassuring, holistic promise. It expands the scope from the individual patient to the betterment of the world at large, reminding us of the massive global impact of pharmaceutical integrity.
Which brings us to the end of our explainer today. And I want to leave you with a thought based directly on the hashtags used in this campaign. If quality matters, and patient safety is the ultimate goal, how will you ensure that together we do better today? Whether you work directly in pharmaceutical manufacturing or in an entirely different field that relies on precision and teamwork, how can you apply this we-do mindset to your own professional role? Think about that for a bit. Take the idea of continuous improvement, moral compliance, and dedicated teamwork and see how it transforms your daily processes. Thank you so much for learning with me today, and keep striving for that better tomorrow.